What are the findings in this ECG and possible explanations? ECG shows a paced rhythm at around 60 per minute with pacing spikes preceding each QRS complex. At first look, it may seem that there is P wave before each QRS with a reasonable PR interval suggesting atrial sensed ventricular pacing, A sense V pace sequence or tracking. But close scrutiny shows that PR interval is gradually varying. The atrial rate is also close to 60 per minute, making false appearance of an AV synchronous pacing in some beats. In analog ECGs, the pacing spikes in temporary pacing are usually small as the pacing is bipolar with both electrodes within the ventricle. In digital ECGs, such small spikes are usually wiped out by the filter settings and the ECG appears like a left bundle branch block LBBB pattern as seen in this ECG of another person with pacemaker. But switching on the pacing detection algorithm in digital electrocardiographs enhances the pacing spike detection, and sometimes the spikes are seen prominent even with temporary bipolar pacing as in this case. Otherwise, a large spike indicates unipolar pacing between pacemaker can and lead tip electrode, which can occur only with a permanent pacemaker. The temporary pacemaker cover is non-conducting and is situated outside the body without electrical contact. The QRS pattern mimics LBBB pattern with left axis deviation as is usual with right ventricular apical pacing. If the lead tip slips and paces the right ventricular outflow region, it will give an LBBB pattern without inferior axis. Right bundle branch block RBBB pattern, if it occurs in the setting of temporary pacing, may indicate lead tip perforating either the interventricular septum and pacing the left ventricle endocardially, or the right ventricular free wall and pacing the left ventricular epicardium through the pericardial cavity. Here the interval between the pacing spike and the QRS complex is very short, so that there is good conduction at the lead endocardium interface. If that interval is prolonged, it would indicate a first degree exit block at the lead endocardium interface, pacemaker ventricular block. If the block is severe, it can lead to intermittent pacing, second degree pacemaker ventricular block, or loss of capture exit block. First degree pacemaker exit block in another ECG from a permanent dual chamber pacemaker. The interval between the atrial spike and the P wave is about 120 milliseconds. The interval between the ventricular spike and the QRS complex is just above 40 milliseconds. Here are a couple of important journal references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.